the world will see this.
Sir,
ಸ್ವಲ್ಪ ನಿಮ್ಮ ಲೆಫ್ಟ್ ಸೈಡ್ ನೋಡಿ ಸರ್, ಎಲ್ಲ ಲೆಫ್ಟ್ ಸೈಡ್ ಈ ಕಡೆ ಇದ್ದಾರೆ ಕ್ಯಾಮರಾ.
See to the left, see to the right, and see in the center. It's a help for them.
I want to now formally exchange the documents that have been shared back to Japago, and we look forward for a very great collaboration. As Srikanth said last, but not the least will be Divakar, but a very significant moment for us personally, for the HDR Foundation, which knows very well its limitation that one organization, one person cannot do it all. The scale and scope of collaborating with Japago is large. If we really want to make a difference in our country, we need to hold hands, and so graciously and gratefully Dr. Amit Shah, the country director of Japago, has put his best foot forward, trusting us, joining us for this massive mission. Amitji.
So thank you. So today it's a privilege to represent Japago over here. Thanks to Hema ma'am for inviting me and my colleague Dr. Parvez over here. So as ma'am mentioned, as ma'am mentioned, Japago is an affiliate of Johns Hopkins University. Japago is an affiliate of Johns Hopkins University. We are a global not-for-profit working in over 30 countries for improving healthcare, and improving women's health is at the core of our work. The single most important question that keeps driving us is how do we ensure that quality healthcare is accessible and available to those who need it the most across the world. Now, the wheel that was presented today here by ma'am is truly transformative and a game changer, because for the first time it puts this whole preventive aspect and promotive aspects of women's wellness at the forefront, especially in private healthcare. And we believe that what is starting off here in Namma Karnataka can really show the way for the rest of the states in India as well as globally. So we are truly proud on behalf of Japago to collaborate with Artists for Her as well as SDR Foundation, where Dr. Divakar's whole innovation, passion, dedication, and her leadership is driving this movement. So thank you all for making us a part of this.
Thank you very much. Dr. Divakar.
On behalf of myself and Dr. Hema Divakar, representing SDR Healthcare Foundation, which stands for Hema Divakar Health Foundation, is privileged to launch this Wellness on Wheels along with Japago as a collaborators and Shantanu as a Grotto Health as a collaborator. Here you can see all the 11 or 12 points each, depending ಎಲ್ಲ ಹೆಣ್ಣು ಮಕ್ಕಳು ಸ್ಟಾರ್ಟಿಂಗಿಂದ ಹಿಡಿದು ಎಂಡ್ ಏನಾಗುತ್ತೆ ಎಲ್ಲದದ್ದು ವಿಚಾರಗಳು ಒಂದೊಂದು ಪಾಯಿಂಟ್ಸ್ ಇದೆ, ಇದೆಲ್ಲ ಕವರ್ ಅಪ್ ಮಾಡುತ್ತೆ. ಸೊ ಎಲ್ಲ ಡಿಸೀಸ್ ಕವರ್ ಅಪ್ ಮಾಡೋದಕ್ಕೆ ಈ ರಿಮೋಟ್ ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ಸ್ ಎಲ್ಲ ಯೂಸ್ ಮಾಡ್ಕೊಂಡು ಮಾಡ್ಬೋದು. ಅದನ್ನು ತೋರಿಸ್ತಾ ಇದ್ದೀವಿ. ಎಲ್ಲ ವಿಲೇಜ್ ಎಲ್ಲಿಂದ ಬೇಕಾದ್ರೆ ಮಾಡಿಬಿಟ್ಟು ನಾವು ಸಿಟಿ ಸೆಂಟ್ರಲ್ ಇದ್ದು ಡಾಕ್ಟರ್ಸ್ ಅಡ್ವೈಸ್ ಕೊಡ್ಬೋದು, ಆ ಥರ ಎಲ್ಲ ಮಾಡ್ಬೋದು. ಸೊ ಇದಕ್ಕೆ ಜಪಾಗೋ ಅಂತ ದೊಡ್ಡ ಸಂಸ್ಥೆಯಿಂದ ಉಪಯೋಗ ಆಗುತ್ತೆ ತುಂಬ ನಮಗೆ. ಸೊ ಅದಕ್ಕೆ ಕೊಲಾಬ್ರೇಟ್ ಮಾಡಿಕೊಂಡು SDR ಹೆಲ್ತ್ ಫೌಂಡೇಶನಿಂದ ಇಂಪ್ಲಿಮೆಂಟ್ ಮಾಡೋಣ ಅಂತ ಇದ್ದೀವಿ. ಅದಕ್ಕೆ ನಿಮ್ಮ ಸಹಕಾರ ಬೇಕು. ನಮಗೆ ಪಬ್ಲಿಕ್ ಎಲ್ಲ ಗೊತ್ತಾಗಬೇಕಿದ್ರೆ ಎಲ್ಲ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಅಂತ. ಸೊ ಎಲ್ಲ ಮೀಡಿಯಾಗೆಲ್ಲ ತುಂಬ ಥ್ಯಾಂಕ್ಸ್ ಬಂದಿರೋದಕ್ಕೆ. ಆ್ಯಂಡ್ ಇದನ್ನು ಅರೇಂಜ್ ಮಾಡಿರೋ LJSPR ಕಂಪ್ನಿಯವ್ರಿಗೂ ನಮ್ಮ ಹೃತ್ಪೂರ್ವಕ ಧನ್ಯವಾದಗಳು. ಥ್ಯಾಂಕ್ ಯು.
A great work is done, which in fact we have spoken, but once more we can talk one of the kind of a cervical cancer thing, which again has happened from the HDR Foundation, and that too for the first time in Karnataka and in India also. That is only at advocacy level, but HDR Foundation brought it to a practical level with so many taluk level headquarters already covered in actual vaccination being done.
ಸುಮಾರು 16 ವರ್ಷಗಳಿಂದ ನಾವು ಗವರ್ಮೆಂಟ್ಗೆ ಸಹಾಯ ಕೇಳ್ತಾನೆ ಇದ್ವಿ. ಇದು ವ್ಯಾಕ್ಸಿನೇಷನ್ ಬಂದಿದೆ, ಬೇರೆ ದೇಶಗಳೆಲ್ಲ ಉಪಯೋಗ ಮಾಡ್ಕೊಳ್ತಿರುವಾಗ ವೈ ನಾಟ್ ಇನ್ ಇಂಡಿಯಾ, ವೈ ಅವರ್ ಗರ್ಲ್ಸ್ ಶುಡ್ ಬಿ ಡಿನೈಡ್ ಅಂತ ಸುಮಾರು ವರ್ಷ ಕಳೀತಾ ಹೋಯ್ತು. ಪ್ರತಿ 3 ನಿಮಿಷಕ್ಕೆ ಒಬ್ಬ ಮಹಿಳೆ ಸಾಯ್ತಾರೆ ಅನ್ನೋ ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸ್ ಬಂತು. 1 ವರ್ಷಕ್ಕೆ 75,000 ಮಹಿಳೆಯರು ಸಾಯ್ತಾರೆ ಅಂತ. ಇದನ್ನ ನಾವು ಹೇಳ್ಕೊಂಡೆ ಎಷ್ಟು ದಿವಸ ಓಡಾಡ್ತೀವಿ. ಅದಕ್ಕೆ ನಾವು ಹೇಳಿದ್ವಿ, ನಮ್ದು ಫೌಂಡೇಶನ್ HDR ಫೌಂಡೇಶನ್ ಇಂದ ಪಬ್ಲಿಕ್ ಪ್ರೈವೇಟ್ ಪಾರ್ಟ್ನರ್ಶಿಪ್ ಅಲ್ಲಿ ಯಾರೇ ನಮ್ಗೆ ಸಹಾಯ ಮಾಡಕ್ಕೆ ರೆಡಿ ಇರಲಿ, ನಾವು ಇದನ್ನ ಮಾಡೇ ತೀರೋದು ಅಂತ. ಕಳೆದ 6 ತಿಂಗಳಿಂದ ನಾವು ನಮ್ಮ ಕರ್ನಾಟಕದಲ್ಲಿ ಸಾಕಷ್ಟು ಕಡೆಗಳಲ್ಲಿ ಇದನ್ನ ಮಾಡಿ ಇದಕ್ಕೆ ಒಂದು ವಿಸಿಬಿಲಿಟಿ ಕೊಟ್ಟವರೇ ಮೀಡಿಯಾ ಅವರು. ಅದು ಎಲ್ಲ ಕಡೆ ಹಾಗೆ ಬಂದಿದ್ರಿಂದ ನಮ್ಮ ಹೆಲ್ತ್ ಮಿನಿಸ್ಟರ್ ಶ್ರೀ ದಿನೇಶ್ ಗುಂಡೂರಾವ್ ಅವರು ಕಾಟ್ ಹಿಸ್ ಅಟೆನ್ಷನ್. ಅದಕ್ಕೆ ಈಗ ಗವರ್ಮೆಂಟ್ ಕೂಡ 5 ಡಿಸ್ಟ್ರಿಕ್ಟ್ಸ್ ಅಲ್ಲಿ ಇದೇ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಡ್ರೈವ್ ನ ಅನೌನ್ಸ್ ಮಾಡಿದೆ. ಜಿಯೋ ಆರ್ಡರ್ ಕೂಡ ಬಂದಿದೆ. ಇದೇ ತರ ಒಂದೊಂದು ಕಡೆಯಿಂದ ಇದು ಒಟ್ಟು ಸೇರಿ ನಾವು ಧ್ವನಿಗೂಡಿಸಿದ್ರೆ ಖಂಡಿತವಾಗಿ ಗವರ್ಮೆಂಟ್ ಜೊತೆಗೂ ನಾವು ಕೈ ಜೋಡಿಸೋ ತನಕ ನಮ್ದು ಬೃಹತ್ ದೇಶದಲ್ಲಿ ಬೃಹತ್ ಪ್ರಮಾಣದಲ್ಲಿ ಕೆಲಸ ಆಗಲ್ಲ ಅಂತ ಗೊತ್ತಿದ್ರು ಕೂಡ ನಮ್ಮಂತ ಚಿಕ್ಕ ಪುಟ್ಟ ಸಂಸ್ಥೆಗಳು ಶುರು ಮಾಡಿದ ಒಂದು ಕೆಲಸದಿಂದ ಬೃಹತ್ ಆಕಾರವನ್ನು, ಆ ವಾಮನ ಅವತಾರ ಅಂತಿರಲ್ವಾ, ಆ ಅವತಾರದಿಂದ ನೀವು ಪೂರ್ತಿ ಎಲ್ಲಾನು ಕವರ್ ಅಪ್ ಮಾಡೋ ತರ ಅದು ನಮ್ದು ಅಲ್ಪ ಪ್ರಯತ್ನ ಅಂತ ನಾನು ಹೇಳ್ಬೋದು. ಒಂದು 6,000 ಯುವತಿಯರಿಗೆ ನಾವು ಆಲ್ರೆಡಿ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಕೊಟ್ಟಿದ್ದೇವೆ. ದಿನಕ್ಕೂ ಅದರ ಬೇಡಿಕೆ ಹೆಚ್ಚಾಗ್ತಾ ಇದೆ. ಹಾಗೂ ಸ್ಕ್ರೀನ್ ದ ಮದರ್ ಅಂಡ್ ವ್ಯಾಕ್ಸಿನೇಟ್ ದ ಡಾಟರ್, ಈ ಒಂದು ಟ್ಯಾಗ್ ಲೈನ್ ನಾವು ಇಟ್ಕೊಂಡು ಮಹಿಳೆಯರಿಗೂ ಹಾಗೂ ಅವರ ಮಕ್ಕಳಿಗೂ ಈ ಸೌಲಭ್ಯವನ್ನು ತಲುಪಿಸ್ತಾ ಇದ್ದೀವಿ ಅಂತ ಹೇಳಲಿಕ್ಕೆ ಇಷ್ಟಪಡ್ತೇನೆ. ಮುಂದೆ ನಮಗೆ ಬೇಕಾದಷ್ಟು ಕೆಲಸ ಮಾಡೋದಿದೆ. ಈ ವೀಲಲ್ಲಿ ನೀವು ನೋಡ್ತಾ ಇದ್ದೀರಾ, ಕ್ಲೈಮೇಟ್ ಚೇಂಜ್ ಇಂದ ಹಿಡಿದು ನ್ಯೂಟ್ರಿಷನ್ ಮತ್ತೆ ಡಯಾಬಿಟೀಸ್ ಅಂತ ಡಿಸೀಸಸ್, ಮೆನ್ಸ್ಟ್ರಲ್ ಹೆಲ್ತ್, ಸೆಕ್ಸ್ ಎಜುಕೇಶನ್, ಜೆಂಡರ್ ವೈಲೆನ್ಸ್, ಮೆಂಟಲ್ ಹೆಲ್ತ್, ಕಾಂಟ್ರಸೆಪ್ಷನ್, ಇನ್ಫರ್ಟಿಲಿಟಿ, ಹೈ ರಿಸ್ಕ್ ಪ್ರೆಗ್ನೆನ್ಸಿ, ಪ್ರೀ ಕನ್ಸೆಪ್ಷನಲ್ ಕೇರ್, ಕ್ಯಾನ್ಸರ್, ಪೋಸ್ಟ್ ಮೆನೋಪಾಸಲ್ ಇರೋ A to Z ಅಂತ ನಾವೇನ್ ಹೇಳ್ತೇವೆ, ಮಹಿಳೆಯರ ಆರೋಗ್ಯ ಜೀವನದ ಚಕ್ರದಲ್ಲಿ ಅವರಿಗೆ ವೆಲ್ನೆಸ್ ಅನ್ನು ನಾವು ತುಂಬಿಕೊಡ್ಬೇಕು ಅಂತ ಆಶಿಸುತ್ತಾ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಹೃತ್ಪೂರ್ವಕ ಧನ್ಯವಾದಗಳನ್ನು ಹೇಳುತ್ತಾ, ಈ ಪ್ರೆಸ್ ಮೀಟಿಂಗಲ್ಲಿ ನಿಮಗೆ ಏನಾದರೂ ಪ್ರಶ್ನೆಗಳಿದ್ದರೆ ಈ ನಿಮ್ಮ ಸರದಿ ಈಗ ಟು ದ ಬೆಸ್ಟ್ ಆಫ್ ಆರ್ ಕೆಪಾಸಿಟಿ ವಿ ವಿಲ್ ರೆಸ್ಪಾಂಡ್. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
It's now open one for any special video bites or for questions directly.
ಮೇಡಮ್, ಈ ಕಿಟ್ ಯಾರಿಗೆ ಯೂಸ್ ಆಗುತ್ತೆ? ಪೇಷಂಟ್ಗ, ಡಾಕ್ಟರ್ಗ ಅಥವಾ ಹಾಸ್ಪಿಟಲ್ಗ?
ಈ ಕಿಟ್ಸ್ ನಾವು ನಾನು ಒಂದು ಲಿಸ್ಟ್ ತೋರಿಸ್ತೇನೆ ನಿಮಗೆ. 10 ಆಸ್ಪತ್ರೆಗಳಲ್ಲಿ ನಾವು ಸ್ಟಾಫ್ಗೆ ಟ್ರೈನಿಂಗ್ ಕೊಟ್ಬಿಟ್ಟು ಕಿಟ್ನ ಸ್ಟಾಫ್ ಯೂಸ್ ಮಾಡ್ಬೋದು. ಸೊ 10 ಹಾಸ್ಪಿಟಲಲ್ಲಿ ನಾವು ಈ ಕಿಟ್ಸ್ ಇಡ್ತಾ ಇದ್ದೇವೆ. ಅದು ಫಸ್ಟ್ ಫೇಸ್ ನಲ್ಲಿ ಇನ್ನು 3 ತಿಂಗಳಲ್ಲಿ ನಾವು ಇದನ್ನೆಲ್ಲ ನಮ್ದು ಯಾವ ರೀತಿನಲ್ಲಿ ಇದು ನಾವು ನಡೆಸ್ಬೋದು ಅನ್ನೋದನ್ನ ಒಂದು ಗಟ್ಟಿ ಮಾಡಿಕೊಂಡು ಅದೇ ಸ್ಟಾಫ್ ನರ್ಸಸ್ನ ಬಳಸ್ಕೊಂಡು ಇನ್ನು 10 ನರ್ಸಿಂಗ್ ಹೋಮ್ಸ್ ಅಲ್ಲಿ ಅವರು ಕಿಟ್ ಇಟ್ಕೊಂಡು ಹೋಗ್ಬೇಕಷ್ಟೇ ಅಲ್ಲಿಗೆ. ಅಂದ್ರೆ ಏನು ನಮ್ದು ಅದು ಮಾಡಕ್ಕೆ ಅನುಕೂಲ ಆಗತ್ತೆ ಅನ್ನೋ ಒಂದು ವಿಷನ್ ಇಂದ ನಾವು ಈ ತರ ಮಾಡಿರೋದು. ಪ್ರತಿಯೊಬ್ಬರು ಕೂಡ ತಮ್ಮ ನರ್ಸಿಂಗ್ ಹೋಮ್ಸ್ ಅಲ್ಲಿ ಯಾವ್ದಾದ್ರು ಒಂದು ಡೇಟ್ ಅನೌನ್ಸ್ ಮಾಡಿ 50 ಜನ 100 ಜನ ಮಹಿಳೆಯರನ್ನ ಕರೆದ್ರೆ ಅದೇ ನಮ್ದು ಟ್ರೈನ್ ಸ್ಟಾಫ್ ಹೋಗಿ ಅಲ್ಲಿ ಇದಿಷ್ಟು ನೋಯೋ ನಂಬರ್ಸ್ ಅಂತ ನಾವೇನು ಹೇಳಿದ್ದೇವೆ ಎಲ್ಲ ಮಾಡಿಬಿಟ್ಟು ಅದರಲ್ಲಿ ಏನಾದರೂ ಪ್ರಾಬ್ಲಮ್ ಇದ್ರೆ ಆ ನರ್ಸಿಂಗ್ ಹೋಮ್ ಡಾಕ್ಟರ್ಗೆ ಆ ಮಹಿಳೆ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿಕೊಂಡು ಮುಂದೆ ಅವರು ಸಲಹೆ ತಗೊಳ್ಬೋದು. ಯಾಕಂದ್ರೆ ಟೆಸ್ಟ್ ಮಾಡಿ ಹಾಗೆ ನಾವು ಬಿಟ್ಬಿಟ್ರೆ ಅವ್ರಿಗೆ ಆತಂಕ ಆಗುತ್ತೆ ಹೊರತು ಅದರಿಂದ ಏನು ಪ್ರಯೋಜನ ಆಗಲ್ಲ. ಅದರ ನೆಕ್ಸ್ಟ್ ಫೇಸ್ ಲೂಪ್ ವಿ ಹ್ಯಾವ್ ಟು ಟೈ ಇಟ್. ಸೊ ದಿಸ್ ಕಿಟ್ ಇಸ್ ಟು ಬಿ ಯೂಸ್ಡ್ ಬೈ ದ ಪ್ಯಾರಾಮೆಡಿಕಲ್ ಸ್ಟಾಫ್ ಇನ್ ಈಚ್ ಅಂಡ್ ಎವ್ರಿ ನರ್ಸಿಂಗ್ ಹೋಮ್. ಸದ್ಯಕ್ಕೆ ಫಾರ್ಮೇಟ್ ಫೌಂಡೇಶನ್ ಅವರು 100 ಕಿಟ್ಸ್ನ ಕೊಂಡ್ಕೊಂಡಿದ್ದಾರೆ. ಇನ್ನು ಮುಂದೆ 1,000 ಕಿಟ್ಸ್ ನಮ್ದು ಯೋಜನೆ ಇದೆ ಇನ್ನೊಂದು 6 ತಿಂಗಳ ಒಳಗಾಗಿ. ಆದ್ರೆ ನಾವು ಕಿಟ್ಸ್ ತಗೊಂಡು ಸುಮ್ಮನೆ ಕೂತಿರೋ ಹಂಗಿಲ್ಲ, ಅಷ್ಟು ಜನನ ಟ್ರೈನ್ ಮಾಡಿ ಅಷ್ಟು ಕಡೆ ನಾವು ಓಡಿಸ್ಬೇಕು ಅದನ್ನ. ಸೊ ಕಿಟ್ ಇಸ್ ವೆರಿ ಹ್ಯಾಂಡಿ ಆಸ್ ಯು ಕ್ಯಾನ್ ಸಿ. ಯಾರು ಬೇಕಾದ್ರೆ ಎಲ್ಲಿ ಬೇಕಾದ್ರೆ ಎತ್ಕೊಂಡು ಹೋಗೋ ಥರ ಎಕ್ವಿಪ್ಮೆಂಟ್ ಶಿಫ್ಟ್ ಮಾಡೋದಕ್ಕೆ ನಮಗೆ ಕಷ್ಟ ಆಗಲ್ಲ. ಸೊ ಇದನ್ನ ಕೆಲವು ಇಂಗ್ರೀಡಿಯೆಂಟ್ಸು ಮನೆಯಲ್ಲೂ ಯೂಸ್ ಮಾಡ್ಬೋದು, ಆದರೆ ಎಲ್ಲರೂ ಇದು ಮನೆಯಲ್ಲಿ ಯೂಸ್ ಮಾಡೋಕ್ಕೆ ಬೇಕಾಗಿಲ್ಲ. ವೆಲ್ನೆಸ್ ಅಂದರೆ ಏನು, ಅವ್ರಿಗೆ ತೊಂದರೆ ಬರೋಕ್ಕೆ ಮುಂಚೆ ನಾವು ಇದನ್ನೆಲ್ಲ ಟೆಸ್ಟ್ ಮಾಡಿ ಏನಾದರೂ ಬಾರ್ಡರ್ ಲೈನಲ್ಲಿ ಇದ್ರೆ ತಕ್ಷಣ ನಾವು ಅವ್ರಿಗೆ ಮಾಹಿತಿ ಹಾಗೂ ಸಲಹೆ ಕೊಟ್ಟು ಅವ್ರನ್ನ ಈ ಕಡೆನೇ ದಿಸ್ ಸೈಡ್ ಆಫ್ ದ ಬಾರ್ಡರ್ ಇಡಬೇಕು ಅಂತ. ನಮ್ದು ಕೆಲಸ ಕೆಟ್ಟೋದ್ಮೇಲೆ ಅದು ನಾವು ಎಷ್ಟು ಮಾಡಿದಕ್ಕೂ ಅಷ್ಟು ಪ್ರಯೋಜನ ಇರೋದಿಲ್ಲ. ಸೊ ದಟ್ಸ್ ವೈ ದಿಸ್ ಕಿಟ್ ಇಸ್ ಟು ಬಿ ಯೂಸ್ಡ್ ಆ್ಯಂಡ್ ಡೇಟಾ ಇಸ್ ಟು ಬಿ ಕಲೆಕ್ಟೆಡ್. ಆ ಡೇಟಾಯಿಂದ ನಮಗೆ ಟ್ರೆಂಡ್ಸ್ ಗೊತ್ತಾಗುತ್ತೆ. ಒಬೆಸಿಟಿ ಎಷ್ಟಿದೆ, ಅನಿಮಿಯಾ ಎಷ್ಟಿದೆ, BP ಎಷ್ಟು ಬರ್ತಾ ಇದೆ ಈ ಪ್ರದೇಶದಲ್ಲಿ, ನಾವು ಯಾವುದಕ್ಕೆ ಜಾಸ್ತಿ ಒತ್ತಾಸೆ ಕೊಟ್ಟು ಹೈ ರಿಸ್ಕ್ ಪ್ರೆಗ್ನೆನ್ಸೀಸ್ ಬರ್ತಾ ಇದೆಯಾ, ಯಾಕಂದರೆ ಮಗು ವಿಚಾರನೂ ಅಥವಾ ಆ ಕಿಟ್ಟೊಳಗೆ ಇದೆ. ಸೊ ಇದನ್ನೆಲ್ಲ ನಾವು ಹಮ್ಮಿಕೊಂಡು ಕ್ಯಾನ್ಸರ್ ಸರ್ವಿಕ್ಸ್ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಆಗಲಿ ಸ್ಕ್ರೀನಿಂಗ್ ಆಗಲಿ ಎಲ್ಲ ಮಾಡೋಕ್ಕೆ ಇದೇ ಕಿಟ್ನಲ್ಲಿ ನಮಗೆ ಅನುಕೂಲ ಇದೆ. ಮತ್ತು ಈ 16 ಈ ವೀಲ್ ಪ್ರಕಾರ ನಾವು ಈ 11 ಕೆಲಸಗಳನ್ನ ಮಾಡಿಬಿಟ್ರೆ ಪ್ರತಿ ನರ್ಸಿಂಗ್ ಹೋಮಲ್ಲೂ ಕ್ಲೈಮೇಟ್ ಚೇಂಜ್ ವಿಚಾರ, ವೇಸ್ಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ವಿಚಾರ ನಾವು ಮಾಹಿತಿ ಕೊಡ್ತಾ ಇದ್ದೇವೆ. ಇಷ್ಟು ಮಾಡಿದ್ರೆ 100ಕ್ಕೆ 80 ಭಾಗ ನಮಗೆ ಒಂದು ಗುಣಮಟ್ಟದ ನೆಕ್ಸ್ಟ್ ಸ್ಟೆಪ್ಗೆ ನಾವು ಹೋಗ್ಬೋದು ಅನ್ನೋ ನಂಬಿಕೆಯಿಂದ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು.
ಮೇಡಮ್, ಈಗ ಗ್ರಾಮೀಣ ಭಾಗ ಆಗಿರ್ಬೋದು ಅಥವಾ ಒಂದಿಷ್ಟು ನಾರ್ತ್ ಸೈಡ್ ಅಲ್ಲಿ ಪ್ರೈವೇಟ್ ನರ್ಸಿಂಗ್ ಹೋಮ್ಗಳಿಗೆ ಹೋಗೋದಕ್ಕಿಂತ ಹೆಚ್ಚಾಗಿ ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟಲ್ಗಳಿಗೆ ಹೋಗೋರು ಹೆಚ್ಚಾಗಿರ್ತಾರೆ. ಏನಾದರೂ ಸರ್ಕಾರದ ಜೊತೆ ಈ ಯೋಜನೆಯನ್ನ ಕೊಲ್ಯಾಬ್ ಮಾಡುವಂತ ಐಡಿಯಾಸ್ ಏನಾದ್ರು?
ಖಂಡಿತ. ಅದಕ್ಕೆ ಜಪಾಯ್ಗೋ ಅಂತ ಸಂಸ್ಥೆಯವರು ಸತತವಾಗಿ ಸರ್ಕಾರಗಳ ಜೊತೆ ದೇಶದಾದ್ಯಂತ ಅವರು ಬೇಕಾದಷ್ಟು ಕೆಲಸ ಮಾಡಿದ್ದಾರೆ. ಮಿಲಿಯನ್ಸ್ ಆಫ್ ಗರ್ಲ್ಸ್ ಅಂಡ್ ವಿಮೆನ್ ದೇ ಹ್ಯಾವ್ ಹೆಲ್ಪ್. ಅಂತ ಸಂಸ್ಥೆಯಿಂದ ಕೈ ಜೋಡಿಸಿದ್ರೆ ನಮಗೊಂದು ದಾರಿ ಸಿಗತ್ತೆ. ಇವಾಗ ನಾವೇ ಒಂದು 10 ಸರ್ತಿ ಹೋಗಿ ಆರೋಗ್ಯ ಸೌಧದ ನಿಂತ್ರು 11ನೇ ಸರ್ತಿಗೆ ಅದಕ್ಕೆ ನಮ್ಗೆ ಅದರಿಂದ ಆಗತ್ತೋ ಇಲ್ವೋ ನಮಗೆ ಭರವಸೆ ಇಲ್ಲ. ಆ ಥರ ಬೇಕಾದಷ್ಟು ಸಮಯನೂ ನಾವು ಅದನ್ನು ಹಾಳು ಮಾಡ್ಕೊಂಡಿದ್ದೇವೆ. ಅದಕ್ಕೆ ನಾವು ಪ್ರೈವೇಟಲ್ಲಿ ಒಂದು ಡೆಮಾನ್ಸ್ಟ್ರೇಟಿವ್ ಆಗಿ ಮಾಡಿ ತೋರಿಸ್ಬಿಟ್ಟು ಇವ್ರ ಜೊತೆಗೆ ಕೈ ಜೋಡಿಸಿ ಇದೇ ಮಾಡೆಲ್ನ ನಾವು ಗವರ್ಮೆಂಟ್ಗೆ ತೊಗೊಂಡು ಹೋಗಿ ಅವರು ಎಲ್ಲೆಲ್ಲಿ ನಮಗೆ ಫಸ್ಟ್ ಡಿಸ್ಟ್ರಿಕ್ಟ್ಸ್ ಹೇಳ್ತಾರೋ ಅದನ್ನೆಲ್ಲ ಮ್ಯಾಪ್ ಮಾಡಿ ಅಲ್ಲಿ ನಾವು ಖಂಡಿತ ಇವರು ಕಾರ್ಯಕರ್ತರು ಎಲ್ಲ ಕಡೆನೂ ಇದ್ದಾರೆ. ಪೂರ್ತಿ ನಮ್ಮ ದೇಶದಲ್ಲಿ ಹಳ್ಳಿನಲ್ಲೂ ಹೋಗಿ ದಿಲ್ಲಿನಲ್ಲೂ ಹೋಗಿ ಇವರು ಕಾರ್ಯಕರ್ತರು ಇರೋದ್ರಿಂದ ಟ್ರೈನಿಂಗ್ ನಾವು ಕೊಟ್ಟು ಹೆಲ್ತ್ ಟೆಕ್ ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ ಅವ್ರು ಕೊಟ್ಟು ಜನಕ್ಕೆ ತಲುಪಿಸೋ ಗವರ್ಮೆಂಟ್ ಪಬ್ಲಿಕ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ಕೆಲಸ ಅವ್ರು ಮಾಡಿ, ಪ್ರೈವೇಟಲ್ಲಿ ನಾವು ಎಲ್ಲ ನರ್ಸಿಂಗ್ ಹೋಮ್ಸಲ್ಲಿ ನಾವು ಮಾಡಿ, ಒಟ್ಟಿನಲ್ಲಿ ಪಬ್ಲಿಕ್ ಆರ್ ಪ್ರೈವೇಟ್ ನಮಗೆ ಮುಖ್ಯ ಅಲ್ಲ. ಪ್ರತಿಯೊಂದು ಕಡೆ ದಟ್ಸ್ ವೈ ಐ ಸೆಡ್ ಎವ್ರಿ ಟೈಮ್ ಎವ್ರಿವೇರ್ ಎವ್ರಿ ವಿಮೆನ್ ಎವ್ರಿ ಗರ್ಲ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಟೇಕನ್ ಕೇರ್ ಆಫ್ ಅನ್ನೋದೇ ಒಂದು ವೆರಿ ವೆರಿ ಸ್ಟ್ರಾಂಗ್ ಇಂಟೆಂಟ್.
accuracy instrument.
ಇದಕ್ಕೆ ವ್ಯಾಲಿಡೇಷನ್ ಇದೆ.
First of all these devices are CDSCO approved. So it requires CDSCO approval to enter any of these devices into the market. The devices are built by entrepreneurs or innovators from IIT Bombay, IISc Bangalore, and accuracy, all these are up to the mark as per gold standard, and importantly all this is validated in some of the best clinical institutes of the country.
In the press release, you have announced thousands of, even in your speech, announced thousands of centers nationwide. What is your exact timeline and funding sources for achieving this, and what happens if these funds dry up mid-project?
Before Amitji speaks, I would like to clarify, we don't want to do anything on a project mode. We want to do it as a movement, and it has to be continuum, and we have to find ways and means not only of the grants and the CSR funds, but ultimately the community has to realize that to cost-effective methodology, they have to also pay for themselves and also the insurance. Amitji.
I think you captured it all. I would just say what we are starting off here.
Cannot hear.
Yeah, what we are starting off here will provide us a lot of valuable lessons even to refine the model that is being there, and definitely the end goal is to scale it up, but it will take over a period of time. So I won't be able to commit to a timeline. I don't think, ma'am.
No, I think in about 3 to 6 months' time, several of the private clinics in Karnataka, about 1,400 have already signed up, but we don't want to run fast. So we are going to scale it up in a manner that everywhere the trained staff and in a protocol-based methodology with the same kit which is validated and with the data which is robustly collected in real time, and the patients not let loose afterwards, because out of 100 cancer screening cases we will find 2 positive. What do we do with them? So that is our responsibility as well. The telecommunication network is being set up, and it's already set up, and we are giving the guidance to the red flags as we call it. So once it is percolated in the private centers, we are hoping that public-private partnership and the government itself should come forth, because they have established the integrated health and wellness centers, the Arogya Mandirs, which are not effectively working towards the desired goal. So we want to strengthen that by our partnership. If at all, we don't want to negate that possibility, but also many of the things which our professional organizations have brought into India today, which have now gone into government recommendations, have first happened to the network of private practice. Private practitioners all over, some of them are well connected with the government as well, and in collaboration, because connect and collaboration is our philosophy. And as I said, we know that just doing something very minuscule will have zero impact. Zero impact. So we want to, the whole purpose of shaking hands with the Japaigos and the care mother of the world is to make sure that there is a continuum, and already we don't want to even tap the CSR funds except those who are already buying out these kits as a part of the CSR activity. We want to audit our experience in the next 6 months, which will set the stage for where we take it from here. But Karnataka for sure will be the ground which will be creating the role model for the rest of the country. So that's the vision, sir.
And your pilot is in Karnataka, as you mentioned right now. But India's most undeserved women are often in the northeast,
yes,
tribal belts,
yeah,
or conflict zones. What is your concrete plan to reach them first rather than last?
Right. So this is a very, very important and an interesting question, and the vision is that as it is with our professional organization FOXY and international organization FIGO, we are training teams of various hospitals right across the country, about 4,000 plus hospitals, including Jharkhand, Assam, Odisha, Ratlam and such tribal areas, interiors as well, for ensuring safe delivery process. That has been our massive mandate in the last decade or so. So we are in connect with pan-India healthcare providers who we have trained, and so they are in our network. So the first phase will be even hard to reach areas which are already in our bracket are going to be empowered to do this. Just very recently, Directorate of Medical Education Karnataka, 700 nursing colleges, they have said that as a finishing school project, assistant to maternal and child safety at delivery with respectful care has been signed off. And the offshoots of those courses are the course on wellness, where all these nurses, before they finish their certification in a nursing school, will also be empowered. So if we have many feet on street soldiers, as we call them, then many of the nurses in Karnataka, sir, are from West Bengal, and very hard to believe, hardly there is anybody from the local place actually. So there are many, so we are offering them placements as well in our wellness clinic. So this is how. So slowly, I think the model will evolve towards what we want to do, and definitely Japaigo is the ace in working in regions of Jharkhand and Assam and northeastern areas, Imphal, Manipur. We have done several projects with them there, but they will be more effectively able to do this in a robust way is what I truly believe, and I do think that the collaboration will take us towards that goal.
One last question.
Please.
What percentage of the funding is from the private partners and government support, and is there a risk of corporate influence over public health priorities? Because I find that quite happening. You start off, but there's a lot of interference of corporate, agenda or whatever it is. How will you address?
No, I think the corporate social responsibility funding that we are taking is to drive our agenda. That we are very, very clear about. It is the wellness of wheels on wellness that's going to happen, wellness on wheels, whatever, with the same structure, same everything. They will not be able to manipulate that. And then there are many, many gynecologists who are in touch with many industrialists, and from their own clout, they are being able to get the CSR funds. For example, In Gulbarga, there was a whole community which they call, now they have rechristened themselves as community connectors. They are rich wives of rich industrialists who said, now we will go beyond the kitty parties. Let's just invest in HPV vaccination. That's how that idea evolved. We wanted to do 100, but we have done 4,000 in that belt alone with the help of those communities. So I think, wheel within wheel is what I expect that it will propagate. And when they see the value in this, I think the strength that we have in collaboration, demonstration, and the sincere intent, which is actually, we are toying with the idea like smart cities. We want wellness villages. Everybody in that village should know their hemoglobin status. Those who are anemic should be given the necessary nutrition, mental health, whether it is everybody. Undiagnosed diabetes cases are 33%. They've never ever got their sugars tested, and they will straight away land up with complications. So all of these we are hoping to reverse when we move ahead, and I do hope that wellness villages concept will also be, that is our idea. So we have a cluster of 20 villages where we are already trying this out near Tiptur, where in a cluster of 5 villages especially, every girl has been vaccinated, something like that. So it's a mass kind of a saturation in that particular belt is what we're planning. So slowly we will move the wheel towards this goal.
Sorry, last question.
Please, I love it. Yeah, because you make me think. Then I commit in public and I will do it.
No, I appreciate, because most of the CEOs of IT or BT, and they just have a grudge if somebody asks too many questions.
Oh no.
Anyhow, I appreciate your willingness to take the questions.
Sure. Of course.
This, I think, is a very important topic or question I'm going to ask you.
Please.
Madam, who owns the health data collected, whether it is the artist, the partners, or the patients, and will this data be sold, shared, or used for research without consent? I think you have covered the research part of it.
For the research part, it will be an anonymized data for sure. The patient will get her personal data, and the repository, which is central, which we have, because when we introduced our hospital app about 10 years ago, this was the key question, and I didn't even understand what it means. That is when we paid a lot of attention to the data security and the data ownership, and then that's when I learned that this data is being sold, etc., etc. So we don't want to definitely get into all of that. So if Shantanu can tell us how the data is going to be.
Yeah. So, first of all, the ownership of the data is, of course, the patient, because it is their own data. And there are, of course, a lot of discussions around how this data being utilized. So, making sure we are compliant to every aspect of it is very important. And when I say the approvals and regulation and research are in place, it covers even the data angle. Now, the CDSCO purview does not just cover the device, but how you are collecting data. When we have ISO 13485:2016, which is very specific quality management system aspect, which covers how we are communicating and storing the data. So there are guidelines to store the data locally, anonymize it, and also importantly, the Privacy Act compliance of it also. So those are, given aspect when we build the technology, and this has been, a very clear guideline that is available, and we make sure we follow it.
Once the data, no, the same question. No, same question. I think that has not been addressed. Since the data will be owned by the patient, so will you have still the scope to monetize that data?
No, to be very honest, monetization of data is not, first of all, goal or neither any aspect of it. Whatever research that has been typically done, even if we have to conduct a research, it is done through Institute Research Board or Ethics Committee, which takes the consent of the patient, and then only you can perform a research. So beyond that, there is no other option that to conduct as well.
I just want to add one.
You can always do that. It will be good for you. This will be one stream, for funding.
No. I just want to respond to that more specifically. The cutting edge conference that you're witnessing here is showcasing a lot of different trends in our own population. Implementation research is my very hardcore, passionate subject. So it is anonymized data, but we are seeing a lot of different trends in the Asian community, out of which the documented data is now emerging from pockets, very many pockets in India. Within our country, it's grossly different, unexpected, streams of data are rolling out. So we are very, very keen that we should demonstrate these trends to the governmental bodies so that some policies can be implemented towards that, where they have to invest. Health economics we have caught hold of. The idea of collaboration, sir, I sold 10 years back. I didn't realize the data was being sold. I didn't realize that how the data consistency and the security should be maintained. That is when mine started thinking of collaborating with professionals like the Doto Health and the Japaigos of the world, because they bring in totally the compliance angle on all these plug-in components. We as gynecologists or healthcare providers for women's healthcare know what we have to do and what is important for our country, because it's a lot being told by the Western world which we are not agreeing, because ours is a totally a different, feasibility is also a problem, but the problems in itself is multiple. So we are very hooked on to basically tell the South Asian community of the health policymakers as well. That is what this data we are seriously hoping to be used for. If the trends are good, we are going the right way, then the investment also from the government is in the right direction is what we believe, and that has already happened in cases of anemia and contraception and some of the other things which we have rolled out in the last 2 decades. So that's a small example of how we are trying to move the needle for diabetes in pregnancy, etc. So some governmental recommendation, very special to our country, has come, which all the whole of South Asia has then bowed down and used it. So we also want to continue our exercise further on those lines as well. So I think that really was the last question, because that completes our document of how we have to draw the roadmap for our own wheel of wellness. So I really appreciate that you asked so many questions. It made us think, it made us spontaneously respond, because the core intent is these responses are well thought through, and that is why it's coming like a spontaneous and intuitive response, because that's really what we want to do. So wish us good luck, and we do hope that we will come back to you at the next Cutting Edge 2026 with what we have done, rolling the wheel and creating the femtech revolution to make this world a better place. Namaskara, and thank you very, very much.